Morning, everyone. I have 10 minutes, and I've been informed that Carol will yank me off the stage if I'm not on time, so I'm going to go through this a little bit quickly. But I'm really enjoyed the conversation this morning in particular because I am a measurement person in terms of my background and specifically focused on teams. So I thought, if I get this right, what I would do first of all, because I think this is important, is to frame how I think about teamwork, the components, the elements, the measures that relate to those components, and then some of the challenges. Okay, so basically what I'm going to do first of all is go over the first two columns on which would be the left-hand side. So when I think about the components of teamwork, I think about the KSAs, right? The knowledge, skills, and attitudes related to team performance. So on the knowledge side, in terms of components, one of the things that team members need to know, whether it's a clinical team or any kind of team, are the roles and responsibilities of the team members. What do they do? What are their roles? What's my role? What are my job assignments and so on as part of that team? What is our goal, right? And how we're going to get to that goal. And then the latter case of those tools, those two elements, we need to have a shared understanding, right? A shared mental model. What is the plan of care? What are the stop points? When do we need to kind of reassemble? What is our goal for the patient? In terms of skills, and that's really where I'm going to focus on in terms of measurement today, what I put up here are the 4 skills for those of you who are familiar with the Team Steps curriculum put out by IMPAQ, which are the basic learnable skills for teamwork that we can teach people. We can teach people how to lead teams and their specific behaviors that go along with that. We can teach people about how to communicate within the team. We can teach them how to monitor, right? If I know those roles and responsibilities, I should know whether or not people are performing to expectations, right? I think in the summer, middle of the summer, when the residents come in, there's a lot of monitoring that goes on, right, in terms of their performance. Mutual support, that's the element. Somebody just made the comment about, you know, it being in different cultural contexts and having other team members to back you up and make the team better than any individual part. Attitudes, I need to think it's important to be part of a team and that teamwork's a good idea, right? And I need to trust my other team members. So the outcomes, right, that we can talk about, we could think about this in terms of the formative aspect, the knowledge, skills, and attitudes, and the outcomes as the summative, better accuracy, timeliness, safety, performance. Okay, so this is how I think about teamwork in terms of these process components and these outcome components. Then we can look at measures, right, that then align with this, and some of the challenges, those are the latter two are right-hand columns. So in terms of knowledge, and we talked about this, I could give them knowledge tests. I could give them a multiple choice test about what do they know about teamwork, what do they know about their specific team, what do they know about the roles and responsibilities. If I'm asking or doing something like that in terms of general teamwork principles, the interesting part is it tends to be too easy. Most people know what to do when it comes to teamwork, even if you ask them how to communicate, which we talk a lot. They know what to do, right? The second thing gets into these ideas where they're tests now to look at knowledge structures, like how do I organize information and think about the roles and responsibilities in the team. Those tests are fairly complex, and I'm not sure how useful they are if I show you an expert's knowledge structure within the team versus a novice. And the novice, you need to think like this, how easy they are from a learning perspective. So on the skills side, and we talked about this, I think Eric gave the example, we could ask people, they could self-report, oh, I'm doing really well, or kind of self-assess. Problem with that is you may not tell the truth. The usual way, and this is the way I'm going to focus on, as Carol said, is about observation, as I put on there in red letters, is it's a necessary evil when it comes to this. And there's obviously some challenges that we've been talking about throughout the morning. Attitudes, usually that's done through self-report. But again, what people do, if you're smart and you were using this as some sort of assessment, is of course I like to work in teams, right? So it's easy to fake. And then finally, the interesting thing about outcomes that we've been talking about that is they're very observable, they're easy to measure, but they neglect the how, right? They tell you what was the result, but they don't tell you how you got to the result. So you all should have in your briefing book an example of a scale that we developed. It's called the Trauma Team Performance Observation Tool. I'm not going to go through it. This just gives you an example of one of the subdomains for leadership. You can see on here the behaviors are very specific, they're observable. This was done several years ago. I'm sure if I looked at it really closely again right now, I'd say, oh, I wish I changed that. Bottom line is this is a tool available. We use it for a study, and the reference for that study is on here if you're interested in looking at this more. But giving the framework of how I think about this, an example of the outcome of how I think in terms of focusing and observing those leadership, communication, situation monitoring, and mutual support, what are some practical guidelines? And I'm going to characterize those in terms of the what, the how, the where, and then a just brief summary. So the what, and I think we've heard this repeatedly, that really the what to observe is the team process element. And that's going to be the hardest, muddiest, messiest part of this to observe. And some of the key things in doing that is really focusing on and understanding what those specific skills and behaviors are. And importantly, right, they have to be observable, right? Mutual trust, for example, is not very observable from a behavioral concept. Right? You have to be able to see it. And importantly, you have to think about this is the what, the why factor. It's not the actual right decision that you're observing. You're observing how the decision gets made. And that's going to be the critical stuff that's important for giving feedback to the team about how to get better. Now, team outcomes, again, are the process. They could be important, right? But from an educational standpoint, I see them as necessary but insufficient, right? We need to have the process measures, and that's where it's going to be a lot harder to observe things. There's a lot of issues related to it. So on the what, team process, I think is the key. See if we advance. The how. So the how generally involves observation. I think there's no escaping it. I think it can work well, but there's a lot of challenges with that, and they fit into all sorts of different buckets. So some of it relates to what tool do I use? What kind of rating scale? You have an example there. What kind of checklist? But importantly, you need to capture on the tool what you're looking for, or some strong exemplars, and that's going to be somewhat moderated by where I'm going to do the observation. If I'm doing it on the job, right, you're going to have a little bit more generic instrument than if I'm doing it in a controlled environment like simulation. There are some nice things out there to help. This article that I cited, this tool called Smarter, and the references in there, is the tool in and of itself is going to connect to the design of the scenario, and this walks you through a step-by-step guidance on how to do this, okay, which is a very applied piece. There's also a tool on the IMPAQ website under the Team Steps tab for designing simulations and scenarios for teamwork and measures. And then it's good practice, I think, in terms of the efficacy and the appearance of these things in terms of looking like solid measures of teamwork to anchor the ratings. What does a 5 mean versus what a 1 means in terms of behaviors, okay? The fact of the matter is, and there's a lot of research on this, that while scale design is important, and most of this research comes out of the performance appraisal literature, what really matters is how you train people to use this stuff. And that's where a lot of the work comes in. And training raters by far is more important than scale design. And the key to that, what all the literature suggests, is you have to teach people to rate and observe from the standpoint of a common frame of reference. So we did a study years ago at United Airlines. We let individual classes of raters train themselves together, like table 1 versus table 2. And while all the raters in table 1 agreed more, looking at the same scenarios with each other, and table 2, within the table, they all agreed more with each other, table 1 and table 2 didn't agree. So you need to have some sort of common standard, especially when you're dealing with lots of people. So where to observe, this is where there's a moderating effect, right? If we look on the job and that tool that I gave you, we use both in the trauma bay and we use in simulation. Obviously, we have a rater effect, and that's going to be more. We had people standing in the trauma bay in our trauma study. That's going to have an impact. And I think also simulation has an effect because people have tacit knowledge about how to behave, or I need to be on my best behavior. It does allow more control. And the nice thing about simulation, and the tricky part with on the job, is I may not see the behavior I'm looking for because nothing stimulated it on the job or tested it. Or in the scenario or in the simulator, I can actually make sure the behavior is elicited and give people multiple times to try and perform it. You know, you might miss the one opportunity. Then what do you do with that? So, in quick summary, because I'm at my 10 minutes, there's no escaping observation. For learning, focus on process over outcomes. Properly training the observers is key. And the interesting thing, over the last 10 years, you will find numerous tools now focusing on different aspects of teamwork and different ways to do it in the literature. So it's been a tremendously growing body of evidence. So there's lots of stuff that exists out there already to help people to do this kind of work.